Welcome to the Deep Dive. Today, we're digging into a really interesting case study. It's about a large health system, one that grew through mergers and found itself, well, wrestling with inconsistent clinical data right across its network.
Yeah, that sounds familiar. It happens a lot when companies merge, different systems, different ways of recording things. It can get messy.
Exactly. Imagine hospitals in different states, maybe using different software, definitely different habits for entering information.
A real headache.
And our sources really highlight the core problem, trying to capture consistent data, especially for important things like clinical registries.
Which are vital for quality tracking and research, right?
Absolutely. But everyone was doing it their own way. Think about the duplicated effort, the potential for errors just creeping in.
Wasted resources, too. People spending time chasing data instead of, well, other things.
Right. And it really hampered their vision of being this unified, efficient network. That big picture goal felt pretty far off.
And in healthcare, that's not just, an operational snag. Bad data, inconsistent data that can impact patient care, research outcomes, even meeting regulations. It's fundamental.
So this system, they weren't looking for a quick fix. No Band-Aids. Our sources say their mission was bigger.
A transformation.
Yeah, exactly. A transformation of how they handled data abstraction entirely. They had some key goals.
Okay, like what?
Faster data submission, definitely. Much better data quality, data they could actually trust. And ultimately making the whole operation more cost-effective.
All driven by, I assume, wanting better patient care.
That was the core driver, yes. High-quality, patient-centered care, plus gaining real control and confidence in their own information.
Okay, so how did they approach this? Did they try to build something internally or?
Well, what's interesting is they decided pretty early on to look for an external partner.
Ah, okay. To bring in expertise.
Exactly. They partnered with a company called Carta Healthcare.
Right. Got it.
And the impact of that partnership, based on what we've read, it seems pretty significant.
Let's hear it. What changed?
Well, first off, costs. The sources use the word dramatic reduction in costs.
Wow, okay. Dramatic suggests more than just trimming the edges. That implies real efficiency gains.
Definitely. And then there's data quality. They track something called inter-rater reliability, IRR.
That's about consistency, right? If different people look at the same record, do they pull out the same data?
Precisely. And they got that IRR figure up to over 98%.
98%. That's incredibly consistent. That means the data is far more trustworthy.
Huge leap, yeah. And it wasn't just accuracy. The partnership helped standardize the process of data abstraction.
So everyone following the same playbook, essentially.
Exactly. Which led to, and this is a quote, remarkably faster and more reliable data submission for those registries we mentioned.
So quicker insights, less lag time. That's a big operational win.
It is. But the sources also stress it wasn't just about the numbers,
Ah, the human element.
Right. By sorting out the data mess, it actually empowered the teams. It freed up their time and, well, mental energy.
Less time wrestling with spreadsheets and databases, more time focusing on
patient care.
Yeah.
Reducing that data burden freed up valuable clinical resources.
That makes perfect sense. Happier staff, better focus.
So the overall outcome, they didn't just hit their goals, they seem to have blown past them.
It sounds like it.
They went from, data frustration and inefficiency to this new level of operational effectiveness, accuracy, and cost savings.
Turning that data headache into a reliable flow of information.
Exactly. And that ultimately benefits the patients, of course, but also the financial health of the organization itself. It's quite a turnaround.
It really shows what can happen when you tackle these foundational data problems head-on, maybe with the right partner. It's not just IT, it affects everything.
So just to wrap up, we saw this large health system facing that post-merger data chaos.
Yep, inconsistent data everywhere.
They committed to a fundamental change, partnered strategically, and achieved really impressive results. Costs down, accuracy way up, efficiency boosted.
A successful transformation, turning frustration into a functional asset.
Which brings us to the final thought for you, the listener.
Yeah, think about your own world, your own work. Even if it's not a massive health system, where might you have inconsistencies?
And how information is captured, maybe, or managed. Little frictions that slow things down, maybe cost resources, or just affect the quality of what you do.
It's worth considering what kind of fundamental shifts or perhaps even partnerships could unlock a whole new level of efficiency and reliability for you. Something to think about.